stage here.
Okay.
We would like to collaborate with someone who will help us in developing delivery systems. Either we use the antisense or we use the small RNA interference or small any other DNA. The traditional drugs are not as efficient, and this is for sure, and this has been proven everywhere in the world. The response rate and the sustained response rate for sure is does not exceed 50%. So we'll have to look for an unusual therapeutic option. So this is our effort to design or to try to look for the most important sequences within the HCV genome that we can design anything against it. There are several people who are working with the anti-proteases or anti-helicases or anti-polymerases, but we believe that from what we read, that the DNA therapeutics is, in our opinion, is the best way.
Thank you.
We have the microphone, please. Microphone.
Can you get mine?
Okay. One moment.
I'm sorry to speak again, but I think this is brilliant work that they needed in this country for just because of the fact what you have just said, that this is a major, major problem. And therefore, please accept my humble congratulations on a brilliant work. My question is simple one. You already talked about the distribution of the virus in different parts of the body. And
The use of the SODN, of the
oh,
antisense.
that the ODN, but does that mirror?
But also the
Does
virus.
that mirror the HCV? Do we know where it hides? And in your delivery, what are you going to target? I mean,
Right.
The immediate thought is you want to go to the liver, but if it's hiding somewhere else, you
It
have
hides.
to target.
Yeah.
Where does it hide?
The largest extrahepatic reservoir is the peripheral cells, peripheral leukocytes, T and B cells. Probably the bone marrow. Many people have shown that bone marrow incorporates virus C, spleen. I didn't go over all the reports, but it seems that it is not only a hepatotropic virus. It can affect at least 5 different tissues in the body.
So that you're going to target that
Yeah,
in your delivery systems.
yeah.
Thank you very much.
Thank you.
Thank you.
If you see this health carrier, you follow them as any of them involve a critical stage of the active virus, or all the
Can you raise your voice?
Yeah, I got the question, yeah. Yeah, I got the question. The question is that what are the fates? What is the fate of these healthy carrier patients? I'll tell you a story about one of these patients who has been infected with the HCV for 10 years. And he has been always like this, following these criteria. Normal enzymes, normal liver architecture, everything was normal. The core antigen was very low or sometimes was undetectable. Extremely low viremia. He was compensating the status. This was for 9 years. The last year, which was the 10th year of the infection, he managed to resolve the infection. No infection. And the patient was completely healthy. The only marker that he was that indicates that he was an HCV patient, that it was the HCV antibodies. That indicates that he has been exposed to infection. But he doesn't have viremia, he doesn't have, everything was normal now, and he managed without any interference with the drugs. And I think this is the patient that I have shown the mutation, the double mutation in the 3D structure of his iris region. So most of these patients, if we do not interfere with them, some of them, I don't have the statistics for this, some of them will resolve the infection.
I really do appreciate the effort done here for such a problem. Would you like to ask a question? Any comments?
Can I ask another question?
Please.
What other clinical categories are you targeting the severe one? Can you still cure somebody who has liver problems and going down the drain?
Non-viral, you mean? Or
With any of these strategies, or once you start having the pathology, is targeting the virus still a viable type of strategy?
The only trial that we have done with these compounds is with the HCV, because there was emerging needs for this.
Yeah, I'm talking about HCV. Once they have liver dysfunction,
Right.
where you have other strategies.
Okay.
Treating currently, which is
So
not-
what they usually do with these people,
Yeah.
they give them the regulated interferon plus liver. I'm not a doctor, but the physicians usually provide the standard therapy, which is the regulated interferon plus liver.
But in the future, you think your strategy will have these patients as well?
We hope, yeah. This is why, we hope to. Actually, it is this work is at infancy. We have investigated the different mechanisms for these healthy carriers to try to search for some light
To get into...
to get into. So we found that some of them they have different immune complexes, and we managed to also to develop a neutralizing antibodies that could interrupt the viral attachment to the cells in vitro, and we could block the viral entrance by 70% efficiency using neutralizing antibodies against highly conserved. The problem with HCV is that, Dr. Magdi, is that it is a very mutating virus, very highly mutating virus. And the region that is supposed to be the most optimum region for developing vaccines or therapeutic antibodies is located within the envelope glycoproteins, which is hypervariable. So you cannot find any two quasi-species looking alike. So the idea is that to look for highly conserved areas, and it should be more or less exposed to trigger the immune response. So we could characterize a highly conserved decapeptide within the envelope E1, which is a little bit hidden compared with the E2, which is more exposed. And we use this to develop antibodies in experimental animals. We use these antibodies in vitro to challenge the viral entrance, and we monitored this by flow cytometry. We found that it really challenges the viral entrance into the cells, which means that if we humanize, or if we use the humanized counterpart of this antibody, we probably also have another option for interfering with the infection.
And you're pessimistic about vaccine?
I cannot tell, it is. I know that many people are working hard on this, especially in the United States and in Japan. Our little resources may, handicap us a little bit to continue. But the reason why I have been here in this workshop, probably to find someone to help me to continue to the next stage, trying to deliver, or to find a suitable delivery system for this.
No, we appreciate the effort you've done for such a thing. Please.
We got a question from Professor Dr. Yaoub about the other strategies. It's a real problem because not only hepatitis B first cause of liver cirrhosis in Egypt is bilharzia, second is hepatitis, third is combined bilharzia and hepatitis, so it's a major problem, and fourth one is cardiac cirrhosis. One of the other alternative strategies for treatment is the use of stem cells through it. There is a team in Cairo University who take the autologous hematopoietic stem cells from the anterior superior spine and separates them and prepares them with hepatocyte growth factor, and then they inject it celographically guided to the spleen. They have finished the animal safety study, and they are going on with the clinical one.